regard to kinesiology. On this course, we have heavily invested in the motor side of skills. Some will say, maybe too much. Due to the fragmentation of knowledge, usually motor-oriented domains lack the understanding that is related to cognitive domains and vice versa. That is, practitioners in cognitive domains do not usually appreciate the importance of motor skills for cognitive functions. However, research shows otherwise. For example, many findings show how areas of the brain that are dedicated to the execution of motor skills, movement, the very same areas are used offline to help cognitive functions such as mathematical calculations. So, even if your locus of focus is steadily fixed on cognitive domains and cognitive expertise, do not miss the opportunity to understand the study of movement, kinesiology. Biology of exercise includes kinesiology, which is the scholarly study of human movement and is typically comprised of biomechanics, exercise physiology, motor development, motor learning, sports pedagogy, and subdisciplines of psychology and sociology, as Najo notes in 2007. From the definition alone, one may already recognize the interconnection of kinesiology and science of exceptional achievement, and especially in regard to virtuosity. In the videos that dealt with motor learning, kinesiology was already contributing to the articulation of the model of motor skills expertise. Now, kinesiology, with a focus in biomechanics, will be contributing to our understanding of virtuosity. Biomechanics is a discipline of kinesiology related to the mechanics of living organisms, the study of the movement of living things using the science of mechanics, defined Hodge in 1974. Biomechanics are important for two reasons: injury prevention and correct technique, both of cardinal importance. Injury prevention and correct technique are also tightly connected, each being separate but unable to exist without the other. So, let's see a major problem for experts, especially for motor experts, which are injuries. But injuries is also a problem. Injury is also a problem for cognitive experts because, for example, of the way they sit, if there is no ergonomy in their surroundings, in the way they place themselves, in the way they stand, etc. Exceptional performance and training to become an expert performer include the repetitive strain the body endures, which is above levels untrained individuals are used to. Even the simple task of sitting on a chair for many hours is not a strain that the body is used to. Oftentimes, this results in injury, most notably overuse injuries, that are both the most common and the most challenging condition to diagnose and treat. In contrast to acute injuries, they usually do not include a macro trauma, but they consist of the cumulative effect subtle injuries have over time, subtle injuries or microtraumas. Classic examples of overuse injuries include tennis and golfer's elbow, runner's knee, swimmer's shoulder, and a host of sports-specific tendonitis. Or, for example, if you sit always on a chair or do an activity again and again, playing a musical instrument, example, there are many tendonitis that might affect you in your wrists, in your hips, etc. Therefore, injury is not a privilege of sports alone. Muscular, skeletal, and neurological overuse problems are common in hardworking experts of the music domain, the ones accumulating more practice hours being usually the ones that suffer the most. This is also according to the findings of Lehman and Gruber 2006 and Brandt-Fodgren 2004, devoted to the etiology, diagnosis, and treatment of medical and psychological disorders related to the performing arts, is the Medical Problems of Performing Arts peer-reviewed journal. Technique is a crucial factor related to injury. Apart from its detrimental effects in performance, poor technique stresses body parts unequally, causing imbalances, which imbalances are a risk factor for injury, as for example Modi et al. Noted, and overuse injury. For example, poor technique in the tennis stroke of one-handed backhand, that is, the lack of proper synchronization in the sequence of segments in the kinetic chain, results in the eccentric flexion of the wrist extensors during impact with the ball, this movement. I forcefully did it. That's why it's an eccentric flexion, which leads to increased strain in the adjacent muscle fibers and ligaments, causing the tennis elbow syndrome. So let's see some basic principles, if you prefer, biomechanical principles. The interdisciplinary approach followed here asks for a set of principles that may adequately describe a wide variety of activities, not restricted to sports, even if this might not perfectly address the exact needs of some cases, as it would happen if specific case-dependent principles were presented. The basic biomechanical principles may be said to be, and this is adapted from Natson 2007. Force motion principle. A force applied on a body will create or modify movement, or equally, no creation or modification of movement may be explained without the application of an external or internal, if we consider muscles to be internal in the body system, force. Forces must first act before any changes in motion can occur. Force time principle. After establishing that forces act first and only later does a modification in movement occur, the force time principle simply states that a very important factor for the final visible result is the length of time a force is applied. Inertia. It is simply defined as the natural tendency of all objects to maintain their state of motion and resist to any change. Simple as it may sound, this concept of inertia defeated the brightest minds for millennia until it was finally explained in the form of the law of inertia, Newton's law of inertia. Range of motion. Even though it is connected almost solely with the concept of flexibility, the latter, flexibility, is just a sub-case of the study of the range of motion. Different situations require that various segments of the body are used in a specific way, sometimes at the limit of their movement range. Balance is the ability of a person to control their body position relative to a base of support. Another crucial issue is the stability-mobility trade-off. A big base of support, when someone adopts a wide stance, for example, translates into very good stability. However, at the same time, this means very low mobility, low potential for movement, in other words. Exactly this inverted relation between stability and mobility is expressed through the balance principle. Postures that promote good stability compromise mobility and vice versa. The kinetic chain principle. With the term kinetic chain, we refer to two things: the concept of the different parts of the human body that are used sequentially, linked, like the rings of a chain, to produce a movement, and equally to the abstract graphical representation of that relation. The kinetic chain is not exactly a phenomenon, but rather a model which helps us to successfully describe and analyze movements, providing at the same time a valuable tool for understanding and applying theory into action, or into praxis, which is a Greek word. Ergonomy. Closely related to balance is the ergonomy principle. Ergo, ergon in Greek, means work, and the second word is economy, economia in Greek. Ergonomy is the applied science of equipment design intended to maximize productivity by reducing the performer's fatigue and discomfort. And ergonomy is really important for individuals who take part into activities such as writing, uh, studying a musical instrument, or doing anything else that has to do with studying still for a long period of time to perform an action. Cause effect and modeling principle, also closely related to causal attribution. Cause of cause effect principle in the short term and in the cause effect and modeling principle, also related to causal attribution. Cause effect principle in the short term and in the mechanical study of forces play a significant role. Practitioners must be able to instantly recognize the immediate causes of specific effects which have an acute implication for the task at hand. Instant recognition of problem areas like dehydration, equipment failure, injury, etc. is an important skill. Finally, let's see two interrelated physiological issues that are very important for both motor and cognitive domains. There are many examples of physiological procedures that need a long-term approach and mindset to produce maximum results. Indicatively, the development of strength, muscle mass, explosiveness, specific bone density, aerobic capacity, and many more motor or cognitive skills. Physiology of exercise may be said to be the substrate on which biomechanics may effectively work. So let's see the placebo effect. Placebo effect, a positive effect produced by the subject's expectations alone, is powerful, widely known, albeit poorly investigated effect. Poorly investigated as far as its mechanism is concerned. It's very well known that the placebo effect is absolutely important and strong, and this is why all medical research requires a placebo effect team. The control it requires three groups: the group that takes the medication, a group that takes placebo, and the control group. The effect has been studied in several sports. See, for example, Birdie 2011, Britain Fall 2009. Placebo effect's strength was demonstrated in an early study that showed how 15 highly weight-trained individuals had amazing performance gains, 7 times greater increase in the rate of strength gain during the placebo supposed steroid period over the pre-treatment training period. That is from 1972, a work done by Ariel and Saville. And many of you know that experienced athletes and experienced weight trained individuals very difficult in very difficulty have gains of any sort. This increase becomes even more astonishing when one is familiar with the fact that, in contrast to untrained individuals, highly trained subjects are immune to training and benefit much less from a proportionally big training volume than untrained subjects do, who, untrained subjects, gain much more when they increase the volume of their exercise. These individuals were actually expected to have smaller gains using real anabolic steroids, and they had greater gains using the placebo. Many improvements believed to be the results of optimal interventions are actually due to the placebo effect. The Pygmalion effect in educational settings is also a phenomenon that is relevant to cognitive skills acquisition and learning in general. It's how the expectation of teachers affect the learners. And finally, the nocebo effect. Nocebo effects, a negative effect produced by the subject's expectations alone, negative expectations of course, are just as strong. The best training might have mediocre results if people are negatively predisposed. The nocebo effect. The nocebo effect, which is a negative effect produced by the subject's negative expectations alone, is just as strong. The best training might have mediocre results if people are negatively predisposed towards it. Nocebo effects are, for example, well demonstrated in the reported case of patients receiving both an experimental drug, a beta blocker in this case, and a placebo in a study from Wilmore and Costil in 2004. Both groups of patients were informed about possible side effects of the drug. One of the authors, Wilmore, explains how impressed he was that in the course of the 6 years of the study, the most serious side effects almost always appeared in the subjects taking the nocebo. So, see you in the next video really soon.